Hi, I'm Dr. Ted, and this is Fracture Friday. For this episode, I have a proximal humerus fracture. Okay, so that's the top end of the humerus or the arm bone. It's up by the shoulder. So when we talk about shoulder or proximal humerus fractures, there's a couple terms that orthopedic surgeons use. One is the surgical neck and the other is the anatomic neck. Okay, the surgical neck is actually where the surgeon may make an incision or an osteotomy or a cut in the bone if we were to do, say, like a shoulder replacement. Okay, so the actual anatomic neck is where the bone goes from being cylindrical, like the diaphysis of the bone, to the metaphysis of the bone. So on this x-ray here, this AP of the humerus shows a anatomic neck fracture. It's relatively comminuted, but that means that there's a very large part of the proximal humerus, the whole basically head of the humerus, or the articular surface of the shoulder, at least the humeral part of the articular surface of the shoulder, is still intact. So that makes it so that we have some more surgical options. You can treat it with a short humeral nail, or you can treat it with a plate and screws. So in this case, we have the lateral here that shows the same thing. It's comminuted, displaced, and it's basically the anatomic neck. Okay, so what was chosen to do here is to put a plate and screws in it to fix it. So this postoperative AP here shows a proximal humeral plate. This plate's actually specifically designed by the manufacturer to fit on the outside of the proximal humerus. And there's multiple screws that go up into the humeral head. Those are actually locked into the plate to create more stability. And then you have multiple screws that go through the proximal diaphyseal metaphyseal junction of the humerus, where that goes from being a cylindrical long part of the bone to flare out like the flute of a champagne glass, maybe, if you will. That you have multiple screws that go through that part of the bone too, to bridge that fracture, to hold it in place, to allow it to heal, to allow some early range of motion. This fracture also was fixed with a screw that goes from the front to the back because there was a fragment we call the lesser tuberosity of the humerus that was displaced, so that has been fixed as well. You can see that better on the lateral here where that screw's going front to back. I hope you enjoyed watching this video. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.